As many as 1 million people could soon lose their health insurance under a new proposal being co-sponsored by North Carolina's newly elected U.S. Senator Tom Tillis.
And while it sounds extreme, Tillis says that he has his reasons.
News 13's Frank Faboni joins us now with tonight's reality check. Frank?
Well, that's right. And now this is for people who get their coverage through their jobs. Under the Affordable Care Act, anyone working 30 hours or more is considered a full-time employee. The Tillis legislation would change that to 40 hours per week, he says, to save jobs.
I'm looking for full-time.
People seeking jobs are desperate to find full-time work and insurance. Getting insurance important to you?
Oh, yes, because, you have to stay healthy. You never know what's going to happen.
Philip Lounsbury, an applicant at a recent job fair, says he's seen it himself in the past. Employers keeping workers below 30 hours.
They flat out told me that in the interview process that it would be under 30 hours a week.
Obamacare forces some businesses to provide health care for full-time employees, and it defines full-time as an average of 30 hours a week. Many Republicans, including newly elected North Carolina Senator Tom Tillis, want to get rid of that part of the law.
The problem that we're having is that for employers who may have people working 35 or 36 hours a week, they've made the decision to take them down to 29 hours a week.
That means less take-home pay for many people in low-wage jobs.
So you're going to really have to start analyzing what an employee who works over 30 hours a week, beyond their wages and everything else associated with employing them, adding this cost to it.
Greg Catavinas, CFO of the Brummett Restaurant Group, says the 30-hour rule threatens to increase the cost of health insurance for all its employees. He says the company may have to reduce the amount it pays toward each employee's premium to accommodate more insured workers.
There's a budget for all types of incentives for our employees, and our main goal is to always take care of our employees.
Insurance providers say employers are faced with tough decisions.
It's had a huge financial impact on some employers who suddenly had to cover many more employees under their benefits plan than they had in the past.
Changing full-time status to mean employees who work at least 40 hours a week would take some of those health care costs away from business owners. The Congressional Budget Office estimates about 1 million people would lose their employer-sponsored health benefits. And those part-timers working the same or even more hours would likely need government subsidies to get affordable insurance. The CBO estimates it would add $18 billion to budget deficits over the next 5 years. News 13 wanted a reality check on all these numbers, so we asked Senator Tillis how it all adds up.
The other side of the equation are the number of jobs that are lost if they do that, if they incur the additional cost that the Affordable Care Act that employers may have to take on. I've spoken with a number of these same employers who said that if they are forced to provide that additional coverage, they will have no option but to reduce the people on their payroll.
If Tillis is right, many others could be joining Philip Lounsbury in the search for a job with benefits.
And here they're offering both full-time and part-time.
Of course, we want to try and provide health care to as many people as possible, and we've got to solve some of the access to health care problems that we have. The way that we're going about it's wrong. It's costing people income, it's costing them hours, and it's disrupting their lives and their families' lives.
The 40 hours is full-time legislation, has passed the House, but still needs a vote in the Senate. Tillis is still uncertain whether they'll have enough votes to override a presidential veto. Larry?
Well, if you have an idea for a reality check for us, contact us.
Send an email to realitycheck@WLOS.com if there's an issue you'd like News 13 to look into.